The general principle of hydrogen breath test is that bacteria in intestine by carbohydrates fermentation produce hydrogen, and from hydrogen they produce another gas, methane, and then by some sequence of events, methane and hydrogen exhaled by lungs. And at this final stage it is possible to determine by hydrogen breath test the quantity of gas that bacteria produce. And the amount of gas that bacteria produce is important because it depends on two factors: bacteria quantity and the amount of unabsorbed carbohydrates in intestines that are the substrates of bacteria fermentation. So in what conditions there is increase in bacteria gas production? First of all, in small intestinal bacterial overgrowth. It's a condition when in small intestine present larger than normal quantity of colonic bacteria, so there is rise in bacteria quantity, and rise in bacteria quantity causes increase in gas production. The second condition is related to carbohydrates malabsorption, for example lactose intolerance, when there is increase in unabsorbed carbohydrates, and with rise in substrates of bacteria fermentation there is increase in gas production. The third condition is related to rapid or slow passage of food through intestine. For example, rapid passage of food is what exactly happens in dumping syndrome when there is not enough time to absorb all of carbohydrates in duodenum, so there will be increase in unabsorbed carbohydrates in intestine, particularly in large intestine, and with rise in substrates of bacteria fermentation there will be rise in gas production. All of these conditions have common feature, increase in bacteria gas production, so there will be similar symptoms that are related to excessive gas production as abdominal pain, bloating, distension, flatulence, and diarrhea. So what is the pathway of gas in human body? If dietary carbohydrates are not absorbed in small intestine, they transit along the GI tract into the large intestine, where bacteria fermentate them with production of hydrogen and methane. Most of the gas is absorbed across the lining of the large intestine into the blood, and with bloodstream gas transported to the lungs. In the lungs, gas exchanged from the blood into the airways, and as a result hydrogen and methane gases breathed out from the lungs, and it became possible to measure their quantity by hydrogen breath test. And because the only source of hydrogen gas in the breath is the gas that is produced by bacteria in intestine, this test became useful in diagnosis of small intestinal bacterial overgrowth, carbohydrates malabsorption, and conditions with rapid or slow passage of food.